Hi, I'm Dr. Molly with Your Goals Physical Therapy. We have all done that embarrassing thing where we slipped or we tripped, we fell in some way, and we get up and we look around to see if anybody saw us. And then if we can, we keep on walking and deal with whatever drama occurred from the fall later. And that is actually what inspired this particular video this week. I got a phone call from a friend of mine who slipped in the shower. If that is not the most embarrassing thing to have to call and admit to, for one, and two, now you're injured and you don't know really what to do. And that's where my friend found himself. And so I thought that I would go over the questions that they had with other people, because I don't think that they're alone. Their question, so it was him and his wife, so they're calling me on speakerphone. We're trying to figure out if they had to go to the ER or if they could wait and maybe see somebody later, and then what they could do right now to make sure that their shoulder had the best chance of healing quickly and not having any other damage. So that's what I'm going to answer in this video. Now, giving people advice on whether or not you should go to the ER or not is very tricky over the internet because I am not looking at you, so this is a generalization based on the information I had with this particular story. If you're in a situation where you're really debating whether or not you should go to the ER, if your body's telling you you should, probably listen to your body. We innately know so many things that we discredit. But I don't think I'm really talking to that person because I think they'd already be halfway to the ER by now. I think I'm talking to that person who either doesn't really understand what's going on, if they truly are injured, and or you're that person that really doesn't want to go to the ER and be told all you have to do is ice it, go rest for 5 days, you'll be fine, right? If you're trying to avoid that whole situation, because going to the ER is not fun and tends to be rather expensive. So if you're really sitting there going, I would go, but I really just want to make sure I need to go, I'm going to give you a couple of things that you can check off. And if any of those things, especially for a shoulder injury, are there, you probably should. And then I'm going to go and give tips on things that you can do right now if you have injured your shoulder and you're just trying to get a little bit of relief and help it heal as quickly as possible. So let's get started. Do I have to go to the ER right now? That will be the first question that we answer. My friend went a little bit more into detail, so let me tell you his story. His story was that they just moved into a new house, and so they haven't necessarily set everything up. He went in to go take a shower, and he slipped because there's no mat, which by the time I had gotten on the phone with him, they told me they rectified. They went ahead and ordered it. But since he didn't have a mat, he slipped, he fell backwards, he landed on his elbow. And during that impact, he got a sense that his shoulder popped forward and then came back into joint. So it felt to him as if his shoulder went in and out of joint, which has to be a very scary thing, right? If you feel like your shoulder just dislocated, it's not fun. But when he got up, he told me he was able to move his arm. There wasn't a whole lot of bruising or any swelling. So he wasn't really sure if he had to go to the ER or if this was like a wait and see kind of a situation. Now, with that background, I'm going to go through and these are the questions that I asked him to kind of further evaluate whether or not I needed to suggest that he go see somebody pretty immediately, or if he could kind of wait and see if the symptoms subsided and then goes to somebody as appropriate later on. So I asked him if he saw any obvious like physical shoulder deformities, any obvious swelling, like is it getting up to a balloon, bruising, did he feel any numbness and tingling in his arm? I asked him if he heard a pop during the fall. And just for clarification, that pop is not something that you're like questioning. You either hear it or you don't. It is not one of those things where you're like, I might have heard a pop. Most people who hear a pop from an accident, it is very loud and very shocking. So if you're questioning whether or not you heard one, you're probably pretty safe that you didn't, because you would know if you did. And then I asked it, so then I was going to ask a little bit more detail about whether like the pain moving and if he could just keep his arm and let it hang. So for him, he didn't have any obvious swelling. He didn't have any obvious bruising that he or his wife could see, which is good news. There was no major changes in his shoulder altogether. He was able to move it, but when he got to a certain point, it got a little uncomfortable and he really felt like it was going to dislocate. That's not a good sign. And then he didn't have any numbness and tingling, which is, again, really, really good. He was like, I don't notice my arm hanging by me, so that doesn't seem to be a problem either. And so for the most part, my friend was in pretty good shape. He did get the sense that his shoulder wasn't stable, but that was really the only symptom. If he had told me that he had numbness and tingling, if he had told me that there was something obviously deformed, if there was bruising, like pretty, significant bruising, if he had heard a pop, I would have really strongly suggested him go to the emergency room. Certainly if he had multiples of those, I would have really strongly suggested. But in his case, since nothing was really apparent and it was just a little unstable, I said, if you're not really wanting to go to the ER, you certainly can wait. But if it doesn't get better in around 3 days with icing it and some of the other suggestions I'm going to give you, then I strongly urge you to go see a physical therapist. And so, and he was like, well, why a physical therapist and not like an orthopedic? And I was like, well, so if you go into an orthopedic surgeon, they're going to x-ray you, they're going to MRI you, maybe if they think that they need to. But then they're going to tell you you're either going to be fine in a few days, maybe hand you some a sheet of paper with some exercises, but that's going to be the end of the visit. They're really only consulting you to see if you're a candidate for surgery. Whereas if you go to a physical therapist, we look at your whole joint. I'm going to see how stable your joint is, how strong things are, flexibility-wise, other things that can be affecting the joint. In this case, we're talking about the shoulder, but we'd be looking at other things that could be affecting the health of your shoulder. We'd be able to do things to help you with your position and other things to help if you do have pain, to get rid of that pain. Just an overall assessment is going to be a little bit more hands-on, a little bit more detailed. We are still able to say whether or not you more than likely need to go in for an orthopedic surgeon consult, because surgery may or may not be likely. We can't make that determination because obviously we don't have an MRI and we're not the orthopedic surgeon, but we can with our physical exam, we are able to say whether or not physical therapy would be able to help you and whether or not it may be better for you to be going to get a surgery consult. The nice thing is with physical therapy, that day you're going to be getting some form of treatment. Again, even if we can't necessarily help your shoulder in like the really severe cases, which happens very rarely, but in the other 75% of the cases, we are actually quite capable of treating the unstable shoulder and helping it get back to being more stable. And since my friend was already able to move his arm and it was only at pretty high ranges that he didn't feel stable, he was a really good candidate for physical therapy and not having to worry about an orthopedic surgeon. And so I was able to kind of go over that a little bit more in detail, because why wait and go through the orthopedic and x-rays and MRIs and delay getting started on the things that are going to help you get back to what you want to get back to, right? You want to be able to get back to playing the games and sports that you want. You don't want to be waiting one extra step for the MRI report and all this other stuff if you don't need to. Let's just get right to it and start the healing process. So that was my pitch to him for physical therapy. Now, of course, their other question was, okay, well, right now it's not really bothering me, but this thing just happened. What can I do to make sure my shoulder is healthy and strong and I give it the best shot here? I said, so here are some things. Ice it as often as you can think of. So 10 minutes at a time. You could do it every hour if you want. One of the better positions for that is with your elbow supported, which is one of my other suggestions. So if you're just sitting and relaxing, either hug a pillow, so there's like a little bit of space here between your trunk or your side and your elbow, and that allows your shoulder to rest and not be hiked up, and support your elbow because that helps relax your rotator cuff and other muscles around your shoulder so that they don't have to be working. So if they were injured, it gives them a little bit of a break. So icing, support your elbow. The other thing is either subconsciously or consciously sometimes, when we hurt our shoulder, we hold it really tight to our body and we don't let it move. So as we're walking, we're really stiff. You don't want to do that. You want to let your arm, if it doesn't hurt, then let it swing, because honestly, that helps pump out the fluid that may be collecting in your shoulder, helps calm the muscles down. That rhythmic motion of just letting your arm swing, I'm forcing it because I'm standing still, but if you're walking, your arms just kind of swing side to side. That really does help calm all the muscles and ligaments in your shoulder. So try to avoid the I'm not going to let my arm move because it's injured position. So those were the things. Those were my suggestions. He came up with a follow-up, which was, what about a sling? And I said, well, if you feel like your arm needs to be supported throughout the day because it's just getting achy, by all means, a sling is perfect. I happen to know that he works at a desk, that he has an elbow rest. And I said, now, if you find that the elbow rest does just as well, then that's great. If you're going to be out and about and you need people to know not to mess with your shoulder, then go ahead and grab a sling and use that. But if it doesn't hurt to let your arm hang and just relax and be by your side, you want it to be in the most normal position as possible. Again, now, if he had pain, I would have strongly suggested, get yourself the sling. But in my friend's case, he just didn't. So those were kind of the suggestions that I gave my friend, and I hope that they help you. Just to recap a little bit, if you slip and fall and you're trying to decide whether or not you need to, if you have a physical deformity, if you have numbness and tingling in your hand, if you heard a pop or you see a whole lot of bruising coming out so that it turns really dark on your shoulder, go see somebody immediately. Now, if you can't let your arm hang and it's just really achy and driving you bonkers and you can't move it out in any direction, you need to go see somebody, especially if you can't even get it off. Like if you're doing this number to move your arm, you need to go see somebody for that. That's not a good sign. That's something was torn there. Notice one thing I did not really ask about is pain. And the reason I didn't is because a lot of things can hurt. But ultimately, people who have completely ruptured a tendon or a ligament have absolutely no pain. They just can't move it. So that's why in that last sentence, I was like, if you can't even move your arm off your body, that is a sign that you need to go. So pain isn't necessarily 100% the determination on whether or not you need to go to the ER or not, because you could have absolutely no pain and have a very serious injury. So now, after listening to this video, if you are ready and have decided that you need a physical therapy consult, I would love to be that person for you. I'd love to help you get back to your favorite activities. And the links below, I will leave a button that says ask about cost and availability. And if you fill that out, we will contact you at the time that you tell us to set up that evaluation and get you started and answer all your questions that you might have about my clinic in particular. If you're listening to this and you're still on the fence on whether or not physical therapy or another avenue is the right thing for you, and you just like to have a conversation and talk to me or another physical therapist, then you can click the button below that says talk to a therapist. And we'll set that time up and we can chat for 20 minutes and just get all of your questions answered so that you're more comfortable one way or the other. Maybe we're not the best fit, and I have no problems telling you that we would not be the best fit for you based on the information that you give me. Or if I do think that we might be able to help you, I will give you that information as well and explain in a little bit more detail about your specific situation, how we might be able to help you. So I hope that what started off as kind of a sad and rather embarrassing slip and fall ends up being very beneficial and very helpful for you or somebody that you may know. So if you think you could share this information with somebody and it would be a benefit, please do. The more people that know this kind of information, the less anxiety there is and the less worry there is around injuries. We all have random accidents that we don't really want to tell people about. But the best thing is just to heal as quickly as possible and recover and get back to all the things that we're missing